Hey everyone, and welcome. Today we're going to talk about something that's, well, it's one of the simplest but most revolutionary medical treatments ever. We're talking about an unsung hero that has saved millions and millions of lives, and it uses not much more than sugar, salt, and water. So let's get into it.
All right, let me ask you something. If you had to pick one of the biggest, most life-saving medical treatments of the last 100 years, what comes to mind? Something super high-tech, right? Like gene therapy or a new wonder drug? Well, what if I told you the answer could fit inside a cup? We're talking about oral rehydration therapy, or ORT for short.
So, to really get why this simple little solution is such a hero, we first have to understand the problem it's up against. And it's a situation that, way too many parents are familiar with. A really common and sometimes pretty scary childhood crisis. Check out this number. Every single year, just in the United States, the stomach flu, or what doctors call acute gastroenteritis, is responsible for over 1.5 million outpatient visits for kids. That is a huge number of sick little ones, and the real danger here isn't the bug itself, it's the dehydration that it can cause. Now, here's the real challenge, right? It's the vomiting. When a kid just can't keep anything down, getting fluids back into them feels impossible. And this is often where doctors have to turn to more invasive methods, like starting an IV, which is no fun for anybody involved, especially the kid. But what if there was a better way? Well, there is. And that's where our hero comes in, what some have called a true miracle in a cup. It absolutely changed the game for treating mild to moderate dehydration. And this is it. Oral rehydration therapy. And just to be clear, this is not just giving a kid some water or juice. No, it's a very specific, perfectly balanced solution of electrolytes and glucose. And the glucose, the sugar, is the secret ingredient. It actually helps the body absorb the water and the salt way more efficiently. It's so effective that it's the #1 recommended method by both the American Academy of Pediatrics and the World Health Organization. So what kind of impact are we talking about? Honestly, it's kind of mind-blowing. Ever since the World Health Organization got behind ORT back in the 70s, it's been credited with saving over 1 million lives per year around the world. I mean, just think about that. That's the power of this incredibly simple solution.
Okay, so let's just put this side by side with IV therapy for a second. As you can see, yeah, they're both effective, but look at everything else. Is it safe? Well, ORT is non-invasive, no needles involved. Is it cheap? ORT is incredibly inexpensive, while an IV can be really costly. And convenience? ORT can often be done right at home or in a clinic, no hospital admission needed. It's a clear winner.
And look, the numbers don't lie. The success rate is incredible, with a failure rate of less than 5%. That means in over 95% of cases with mild or moderate dehydration, this simple, non-invasive treatment works. It just plain gets the job done. So how do hospitals pull this off so successfully? Well, they don't just wing it. To get these kinds of results, they follow a very clear evidence-based plan. You can think of it like a rehydration roadmap. And this is what that roadmap looks like. It's called a clinical pathway. It's basically a flow chart that guides the entire medical team through every single step, from the moment a child shows up to the moment they're ready to go home. So why don't we walk through this together and see how it all works? Okay, first stop on the map is the assessment. The nurse is going to check for key physical signs to figure out exactly how dehydrated a child is. They're looking at things like skin turgor. That's when you gently pinch the skin on the back of the hand to see how fast it bounces back. If it's slow, that's a sign of dehydration. Every little clue, from dry lips to whether or not there are tears when they cry, helps paint a clear picture. Okay, but it's really important to get this straight. While ORT is amazing, it's not the right tool for every single child. This pathway helps doctors quickly spot the kids who need a different approach right from the start, like very young infants, or kids who have other complex medical issues, or certain red flag symptoms. All right, so let's say a kid is a good candidate for ORT. The team gives the green light. Now, the real magic begins. Let's break down the actual step-by-step protocol that makes this whole thing so effective. Remember that biggest hurdle we talked about, the vomiting? Well, modern protocols tackle that problem head-on. The very first step is often a dose of an anti-nausea medication, like ondansetron. Doing this just dramatically boosts the odds that the child can actually keep the rehydration fluid down, which, sets them up for success from the get-go. The strategy itself is just brilliant in its simplicity. You start slow, giving tiny sips of fluid really frequently.
Then, you observe. You watch carefully to see if the child can handle it. If everything's looking good, you gradually advance, maybe doubling the volume. And then, in a little while, you reassess. It's this careful, patient process that really works.
And as you can see here, this isn't just guesswork. The whole process is incredibly precise. The protocol spells out the exact amounts of fluid based on how much the child weighs. For a little kid, it might start with just 5 milliliters. That's literally 1 teaspoon every 5 minutes. This low and slow approach, well, that's the whole secret. Okay, but what happens when it doesn't work? What about that small percentage of cases where ORT just isn't enough? Well, the clinical pathway has a clear, effective backup plan for that too. First, let's look at the best case scenario. Success means the child is drinking again. They're getting their energy back, their vital signs are looking good, and, this is a big one, their parents feel totally confident that they can continue the process at home. That's the green light to head home. And on the flip side, it's just as important to know what failure actually looks like, so you know when to get more help. It's not just one little spit up. The pathway defines it really clearly. It's continued vomiting, even after getting that anti-nausea medicine, or if the child just flat out refuses to drink for over half an hour. And if that happens, there's no panic. The team just moves to the backup plan: IV fluids. They'll start an IV, give a calculated bolus of fluid, that's a big amount given quickly to get the child rehydrated fast, and then they'll reassess. There's always a safe and effective alternative ready to go. So, as we bring this all home, let's just circle back to where we started, to the core of this whole story, the absolutely incredible power of a simple solution. We're talking about something made from just sugar, salt, and water. This quote from the source material, man, it just says it all. We have this tool that's effective, it's safe, it's cheap, you can get it anywhere, and yet it continues to be underutilized. It's not used nearly as much as it should be, which is exactly why talking about it is so important. And that really leaves us with one last big question, doesn't it? The story of ORT is such a powerful reminder that the best solution isn't always the newest, the fanciest, or the most complicated one. So I'll leave you with this. What other simple, powerful ideas are hiding in plain sight all around us, just waiting for their moment?